Good afternoon, everyone. Thanks for joining us for another update. In fact, our 50th town hall meeting. We've had 50 town hall sessions since the onset of this pandemic earlier this year. And for those of you who have been at every one of them, God bless you. Thank you for following us. And I know that many of you found these to be informative. I know that I appreciate the interaction that we've had together these last nearly dozen months, and our goal is always to try to give you answers to questions and provide you some additional information. And together we have shared hundreds of updates, obviously dozens upon dozens of stories, and together responded to countless questions and comments on social media and directly to county government, which is really my moment to also not only thank you for participating in these last 50 town hall meetings, but also to thank our American Sign Language interpreters. We're very grateful to them. I think we've had only 4 separate different faces. Is that 4? Is that right? But thank you. Nonetheless, you've all been here, and we're grateful for that. I also want to thank the men and women who either have staffed or volunteer staffed our our crisis helpline, mental health helpline, and our COVID-19 hotline, and just countless numbers of calls coming in, and thankfully so many in county government, either reassigned to those tasks or volunteers through a medical reserve corps, or those who stepped up as part of Dutchess Response, all very active, and there on the other end of the phone. And to the communications team here in county government, there are 4 of them, 4 and a half on any given day for the entire county government. And so the slides, the flyers, the communications, the town halls, the telephone town halls, all organized by the communications team, and we're very grateful to all of them as well. So first, if you have a question, write it in the comment section below the live feed. Let's jump immediately to our dashboard. These 11 months, we have conducted 340,798 COVID-19 related tests throughout Dutchess County. That is a reflection of those who have tested, not necessarily a reflection of everyone who's contracted the virus, but we have these months confirmed 10,405 total cases, individuals who have tested positive with COVID-19, and we are currently monitoring 1,657 active cases, 1,657 active cases with 103 individuals now who are hospitalized. We had a call earlier today with hospital administration here in Dutchess County from Mid-Hudson Regional, Northern Dutchess Hospital, and Vassar Brothers Medical Center. All are sort of confident in their ability to handle where we are today, but all remain very concerned that we not have another bump of significance in hospitalization. So I'll say two things. One, we can certainly take steps today to slow the spread of the virus and to slow the rate of growth in hospitalizations. But we should also be prepared for the likelihood that hospitalizations will increase, that cases will increase as we exit the Hanukkah holiday and begin the Christmas holiday, and then certainly into the early part of the new year. Even though vaccines are starting to be distributed and administered, and I'll talk about that in a moment, we still have to be very vigilant in taking steps to slow the spread of the virus because there just are too many people who obviously will contract this, will have a degree of severity, a greater risk, and frankly need hospitalizations. In the meantime, we've also seen 215 of our neighbors die due to COVID-19, and that has been sadly a regular update these last several weeks. We've seen an increase in the number of deaths, and we extend our thoughts and prayers earnestly to their friends and their family. I know during this particular time of year, it's almost doubly difficult for those who have experienced loss, and we just don't want that to continue. So remember, there are things that we can do to slow the spread of the virus, very basic steps that do work. I was on the radio call this morning, and I think it was Uncle Mike. In fact, it was Uncle Mike from what is it? I know he's not WRRV, but which? Oh gosh, it's iHeartRadio. Gosh. Chuck Benford's going to be very upset at me. iHeartRadio. Uncle Mike said, when I had a cold, I wouldn't go out and get other people sick. Just treat everything as something you don't want to give someone else. If you're not feeling well, if you have a stuffy nose, if you have a sore throat, you have a headache, yes, I think you should assume that it's COVID and stay home and then try to get a test or monitor your symptoms and be very sensitive to that. And so from our perspective, take those steps. Physical distancing, smaller gatherings. If you're going to get together for this Christmas holiday, you ought to only do it with a small group of family members that, quite frankly, you trust, that have taken the same basic steps. And if not, then virtual Christmas it is. I'll be doing that with my family. I haven't seen my niece in a number of months. We're going to celebrate virtually. In fact, and they only live down the street from us. But smaller groups and wear a mask. And when we do that, we limit the ability to spread the virus. Wash your hands, monitor your own personal health, and if you feel like you're ill, stay home and stay away from others who might transmit the virus to. Currently, I do want to note that the positivity rate identified on the county dashboard, 6.33%. That is the Dutchess County positivity rate. So the dashboard now reflects the county's positivity rate. This slide shows you the positivity rates in adjacent counties. Dutchess currently 6.3, so this is yesterday's numbers, I assume. But Dutchess is 6.3. Our 7-day average, 6.2%. Orange County, 7.6%. Putnam, 6.5%. Rockland, 6.2%. Sullivan, 8.1%. Ulster, 5.6%. And Westchester, 5.9%. And again, we continue to monitor that as it relates not only to our own situation, but regionally, because the state monitors the positivity rates and the hospitalizations, and from that, we make certain decisions as to activity in the community. If you have a question, write it in that section below the live feed. Matthew, I think I answered the question. You should keep it small. I think, as I said, if you're celebrating Christmas, do it only with those family members that you've had sort of, you all live by the same basic expectations. Now, can you do it in other ways? Certainly. My mother and father are going to visit the driveway of my brother, and they're going to leave the gifts there, and they're going to wave at each other and celebrate a little bit in that way. That's their choice. My stepdad, as you know, my father was taken by the virus earlier this year. My stepdad has some underlying health conditions, and that's how they're going to do it this year. They've been living with us in my house for these last several months, so we'll be celebrating Christmas together. They will be, assuming that everyone's healthy and safe, they'll be leaving my house 2 days after Christmas, driving to Myrtle Beach. We'll miss them. And we will. We love my mom and dad, and we'll miss them. But they'll have been celebrating with us. So that answers your question, Matt. Keep it small, and try to follow those basic protocols. Pauline, we've been told to get tested often, but can't get tested unless you are sick. Where do we go for testing? Good question. First visit dutchessny.gov/coronavirus testing. So I'm going to say this. You should get tested if you feel that you've contracted the virus or have come into contact with someone who's contracted the virus. The testing system in America is not built for everyone coming in anytime they want to be tested. It just isn't. And yes, even I have said get tested often, but you ought to be tested if you feel like you've contracted the virus or come into contact with somebody who's contracted the virus. If you visit dutchessny.gov/coronavirus testing, you can see the locations that are available for testing. Not all locations require you to feel ill, but those that do are likely fewer opportunities because they're trying to process as many as they can, and likely not to have the results as quickly. So, for instance, pharmacies. Several pharmacies, you can drive up and get tested. In fact, you administer it almost yourself, but that's not a requirement that you feel sick. You just have to go through that process, and you're not likely to get the results as quickly. So from our perspective, get tested if you feel you've come into contact with someone who's tested positive or who has contracted the virus, or you yourself have contracted it. You should first contact your physician. In almost every case, your physician has access to testing. If not, there are providers through urgent care and through pharmacies, and locally through Mid-Hudson Regional Hospital. We use often Pulse MD, another urgent care provider, that you can get access to testing. But scheduling that is generally a couple days out, and then results are going to be a couple days beyond that. So you just want to be sensitive to that and aware of that. Is testing free? Well, first, in most cases, first, if you have insurance, the test should be covered by your insurance. You may have to pay a copay. If you have a problem in that you don't have the income and you don't have any other resources, you can reach out to the health department. We do try to connect people with the support necessary to access testing. So New York State has said that testing is supposed to be insurance covered. There are certain situations. I'll get to that, Danielle. Don't worry. You're correct. With that, that's the testing regimen. Danielle, you are correct. We do not encourage you to invite people over to your home. But as I've said consistently, if you have loved ones and family members that you are in my case, my parents in my home, that is certainly something that's acceptable. We don't encourage you to celebrate the holidays with groups of people. But being a realist and understanding that individuals are not going to do everything I want them to do, what we're saying to people is we need you to be safe about that. So if you're not sure about people, about the family members, where they've traveled, things of that nature, you're absolutely correct. You shouldn't be celebrating together. If you're going to ignore that basic advice, then there are steps you can take that you should take. Monitor your own health. If you're not feeling well, you should not go out. And in the same respect, if even in a setting where you feel comfortable, you still should engage in that physical distancing. You still should wear a face covering or mask. That is the guidance that is expected from us. And actually, I've watched the governor. They're not saying nobody. We obviously want you to be safe. So keep those activities as small as possible with individuals who have followed the same basic expectations and protocols. And nobody else. Everything else should be somewhat virtual, or again through perhaps it's in the driveway, it's back and forth through outdoor activity. But that is the advice that we give people. I also recognize that not everyone's going to do what I ask, so we want you to be as safe as we can get you to be. But the best option is to celebrate virtually this year, and only with those that are within your household and have followed those basic expectations. Linda, status of vaccines in Dutchess, and Gary, vaccines for 65 and up. So good news, of course, earlier this week, the FDA approved the Moderna vaccine. That is also a 2-shot vaccine. Vaccines began in Dutchess County a week ago. No delay. Someone asked last week if there was a delay in New York State. No delay at all. And New York State is accessing the quantities that we expected. Vaccines began in Dutchess County last week and started with healthcare providers. They began at Mid-Hudson Regional Hospital, Mid-Hudson Regional acting as somewhat of the vaccine hub, and healthcare providers being able to access that vaccine starting a week ago. As of today, nursing homes are being administered the vaccines. That's being done in partnership with the major pharmacies, CVS, Walgreens among them. And that is underway from today through the beginning of the new year. So all 13 nursing homes in Dutchess County will have chosen to participate in that program and will be receiving vaccines. Now, the state has identified a process that establishes a vaccine hub, and then from that hub, the spokes to distribute that vaccine. That's the language. So Mid-Hudson Regional is the hub. We are required to establish a vaccine task force that includes leadership from the surrounding counties. In Dutchess County, I, along with Kathy Tetmeyer, who is the Assistant Commissioner of Health here in Dutchess County, she's retiring at the end of this year. We thank her for all her years of service, and she's going to take on the responsibility of working with the hub and local providers to administer the vaccine distribution program here in Dutchess County. So Kathy and I will serve as Dutchess County's representatives on this task force. Our responsibility over the next 14 days is to develop a process to get vaccines into the hands of other providers and ultimately into the arms of those who choose to be vaccinated. And that will require we spend some time focusing on the logistics, the refrigeration and distribution, the partners that will be involved in administering the vaccines, and making sure that underserved populations have access. Now, in our community, underserved populations are a number of categories of people. Minority communities, black and brown neighborhoods, poorer communities that might have direct access to healthcare providers, and those who don't have direct access to a hospital or a healthcare system because of geography. All of those areas will be of concern in the plan. To Gary's question, specifically to those who are 65 and older, the next phase of this distribution will be to essential workers and vulnerable populations. That is still being devised, but the expectation is that at some point in the month of January, that process will begin. And we'll hopefully, with the state, have that identified. So figure late January, essential workers, vulnerable populations, and that will go through. Originally, we said until March or April, and then general public will have greater access March or April. The CDC did say 2 weeks ago that perhaps general public access might be sooner than that. So stage one, healthcare providers, nursing home workers, emergency responders. Stage two, vulnerable populations and essential workers as identified by the states. And then stage three, the general public. Last week to the end of the year, healthcare providers. Today to the end of the year, nursing homes. Month of January, essential workers and vulnerable populations into and through February. And then we hope February, March, April, May, general public access. And we'll have more information for you over the next couple of weeks. So good opportunity to tell you we're not going to come to you live next week unless there's an emergent reason for that to happen. You can survive. You won't have to listen to me next week unless there's an emergent reason to do that. But as we begin the new year in our town hall meetings, we're going to start having our telephone town halls again. We're going to have them along with our Facebook town halls as we've had. And the goal in the new year, as we start to get closer to public access to the vaccines, is to have healthcare professionals on either the telephone or through Facebook Live to answer some of your questions. That's the goal and the expectation. We're also working to develop an outreach committee of community stakeholders that represent those areas in Dutchess County that may need greater education and information and may have limited access to healthcare providers. That'll be done in concert with our outreach with the vaccine task force. And we've asked John Penny, who is involved with the census outreach effort, to work with Kathy and a group of stakeholders that will be identified in the new year to help us do that outreach effort. And we want to be clear that since there's not general public access yet, that we want to be sure that we have the right answers to the questions and we're prepared to be as informative as possible. So that'll start in the new year, and that effort will be underway when we get back together. Matthew asks my thoughts on the COVID relief package, and will the county provide any relief to supplement since there's a budget surplus? I have a budget surplus? Who has a budget surplus? I don't have a budget surplus. I mean, we're ending the year having to tap the county's reserves in order to fund county government. But I'll talk a little bit about what we are doing. Number one, I don't think it's enough. Frankly, only in Washington can you spend so much time to deliver so little for ordinary Americans. Sorry, it's not enough. It does not include the state and local aid that's necessary to support all of the work that local governments across America are doing while adding our responsibility. You know, in this state, county governments are responsible for providing public safety, emergency response, the response to domestic violence and child abuse, the response to those who might live with poverty and need social service assistance. Not every state, actually New York is the only state requiring county governments to do most of that work. In other states, the states do that. So in this state, that responsibility is growing because of the challenge we have. We're not whining about it. We have stepped up, and we will continue to step up to that challenge. but this particular relief package is insufficient in that regard. And I said this the other day, and I do mean it. When we needed a lifeline, they gave us a sucker punch. Now we are hopeful that with the next administration coming in, that the leadership in the Senate and the House and the White House can come together on an investment necessary to support local government operations. But failure to do that will be the first time in American history Congress has left its local government partners to fend for themselves. And this is not about some sort of bailout. We have greater demanded responsibilities. There are new costs associated with those responsibilities. There was the depletion of revenue, and that is a real challenge. Now, there are some good components. I just don't think they're sufficient. So there's still PPP coming, so small business assistance is available. However, we're still trying to identify the details. If you qualify for PPE before, do you still qualify now? Will there be greater access? Remember, there were challenges for small businesses to access PPP. Good program, and we worked tirelessly here in Dutchess to support over 10,000 local businesses. But that's a challenge. They adopted a program that cut the stimulus checks or checks to American citizens, lower income limits, less money directly to Americans. Yet they did approve billions of dollars for other things. So we'll keep you posted. Hopefully, in the early part of the new year, we'll be able to speak more detailed, speak about more details. But it's a 5,000-page document, and I'm confident not everyone read it. Before it was adopted. Having served in the state assembly, I can tell you that often happened. But that said, listen, it's a start. Let's just hope it's not the finish. And that, I think, is a value. I do want Matthew, to do reference what we are doing. We'll be announcing today an expansion of our community development program. This is our COVID support initiative that we launched earlier this year through dollars that we did secure through the Community Development Block Grant Program. We're grateful in particular to Congressman Maloney, who was essential in securing that round of dollars. These dollars, so we have another round and more resources that we're putting on the ground. We talked a little bit about it. Here are the programs that we're going to be focused on. So we are launching an eviction prevention program. This will begin in February of 2021. It will provide retroactive rent and utility relief for up to 6 consecutive months. And we'll give you the details about how to apply for that. But we are launching through our COVID support initiative an eviction prevention program beginning in February. It will be retroactive and can provide relief up to 6 months. We are expanding our child care support, our child care scholarship program, and this will cover 75% of child care costs for an additional 45 scholarships. So we'll continue that program. We're partnering with the Child Care Council of Dutchess and Putnam County. We've already supported 35 families, 34 scholarships already. This program and expansion will allow us to support another 45. Additionally, we're expanding our small business assistance, and that is through a partnership with Community Capital. These are grants. These are not loans. These are small business grants. Very successful. We encourage small businesses to reach out, and we'll get you that contact information. And we are partnering with the towns, villages, and cities in Dutchess on several projects that will promote food security and safety for seniors. And we're thankful to the partnership we have with our towns, villages, and cities. But this is an expansion of our COVID support initiative. Again, eviction prevention, child care scholarships, small business grants, and food security and safety initiatives in partnership with our towns, villages, and cities. And you'll be seeing the details of that later today. Christina, what is the number of cases that we closed down? Well, great question. It's not that simple. Matthew, I think, is asking also, is there a threshold or ceiling on the positivity rate that we're watching? Great question. Let's bring up the dash. Let's do this. Okay, good. Thanks. So the new cluster zone. So New York State has identified sort of this framework. It's not simply number of cases, and it's not simply positivity, and it's not simply hospitalization. It's all of those things combined. So if a community is above 3%, which we are, but also has over 10 days, if it has a positivity rate of over 3%, 7-day average over 10 days, we exceed that. and we're in the top 10% of the hospital admissions per capita, and we're experiencing week-over-week growth in daily admissions, we move to the yellow precautionary zone. We're not there yet. And so that's the perspective, that's the measurement that we're all monitoring. It's positivity rate. Positivity rate is the number of positive cases. So to, maybe it was Christine, I think, her question, it's not just simply the number of new cases, it's the number of new cases divided by the total number of positive cases. That gives us that rate, which we are now at 6.3%, exceed 3%. But we're also monitoring the number of daily admissions and whether or not we're in the top 10% of admissions in the state. Why is that important? Because if we see this spike of growth in hospitalizations, our hospital system can't support that, and will need the support of other hospital systems. And if they're spiking as well, that creates the problem. So what the state's created is a framework that does make sense. It's just not easily measured because you need to know the rates of growth in every hospital system in the state. But because we share, and to their credit, the state worked, and we worked very hard to get all of our hospital systems working together in this community, New Vance and Mid-Hudson Regional through Westchester Medical, working together so they can rely on one another. We are not there yet, so we haven't moved. We haven't moved into that direction yet either. So, Jillian, testing access up here is a joke. In New York City, you can walk in, get tested, get results within 2 to 3 days without claiming symptoms. Why? Well, New York City supports the walk-in test centers. Outside of New York City, that is the state of New York's responsibility. So the walk-in test centers are supported by the City of New York in New York City, and then the state of New York outside of New York City. I would offer it's nothing to joke about. I know it's frustrating at times, but New York State only has 2 walk-in centers locally. However, in this community, like every county in America, the testing access is through your healthcare provider, a hospital system, or a healthcare system. In this community, just as every other county in America, facing the same sort of challenges. I can't speak to New York City, but my guess is they are spending millions upon millions of dollars that they may or may not have because they're responsible for that. That is actually their responsibility. Unlike outside of New York City, it's the responsibility of the New York State Department of Health to prop up those testing facilities. And it's not criticism, it's just there is not that capacity. So, Jillian, I took your comment as being a little bit angry, so I'll respond with a little bit of an edge and say, you're welcome to go back and walk into the city to get a test, but please don't. If you need to have access to a test, please visit the county's website or reach out to your healthcare provider. Happy to continue to push on that. We're supporting the testing infrastructure necessary, if need be, to get schools, to keep schools open, and we work with our healthcare providers locally. But again, that's the difference. New York City Health Department runs that operation entirely. Outside of New York City, it's the State Department of Health. Even county health departments are technically an arm, an extension of the New York State Health Department. So again, sorry that you're upset about it. I know it's frustrating. There are a lot of things that frustrate us, but that is the challenge we've had all along. Accessing testing is still a challenge. Frank, how many local homeless people have been found dead of this deadly virus? Well, I'll offer to you that I'm not at liberty to share the details of anyone's health care or condition, but we've not had identified anyone among the homeless community who has died of the virus, but we have had several in the community who have tested positive and have received the support of the county's housing and homeless support infrastructure. While other counties across the state did close homeless shelters, we, of course, expanded ours. It was a bit of a risk. We understood that. But working with Dutchess Outreach, working with Mental Health America, Hudson River Housing, and other service providers, we've been able to provide telemedicine, meals, and shelter to the most vulnerable and homeless population. And we did have several who have tested positive. We either had to isolate them at a location of our choosing. Some were isolated even in hotel rooms. And all were provided access to health care. And to date, no one identified in the homeless community having tested positive with COVID, dying of COVID. No one identified. Doesn't mean it didn't happen. It just means that there's not been that identification. And we continue to monitor that as well. Grady, how can we ensure inmates in Dutchess County access the vaccine? When they become identified in the population that has access to vaccinations, there will be a mechanism for that to happen. So Dutchess County inmates, most of whom in the Dutchess County Jail are there for a short period of time. But again, we would assume that at some point they will be identified as higher risk because of the proximity. And of course, the corrections officers themselves would be identified as essential staff. That's not been determined by the states. The federal government sets the broad policy. The states, 50 of them, will identify specifically who and when vaccines get distributed. It's not my decision, but for those in the state prison system, as I understand it, there is going to be they are going to be included in one of those populations. I just don't know what it is or when it is, and we'll try to provide you additional information. And yes, they are our neighbors in Dutchess County. The county jail inmates, 90% of them return right back to our community because they came from our community. So you are right there, neighbors. But again, priority is healthcare providers, nursing home staff, patients, and then essential staff and vulnerable populations. And I do believe the state intends to include the inmate population in the vulnerable populations because of the situation they live in. You don't want to certainly a breakout in that scenario in that situation as well. So if you have a question, please write it in the comment section below. Trying my best to get to as many as we can. I do want to turn to a little bit of good news. The good news is it snowed. Actually, the good news is we cleaned it up pretty quickly, but it did snow, as you know. So while we're not too sure we're going to have a white Christmas, we are maybe just about on that line. They're suggesting a little bit of rain on Christmas Eve, Christmas Day, but it does look a little bit north and west of us. We might get some snow. But in the meantime, the sledding hill is open at Bowdoin Park. So get your sled, get your toboggan, get your tube, and head on out to Bowdoin Park in the town of Poughkeepsie. A lot of great sledding hills across Dutchess. My family is waiting for the moment to get to Burger Hill in Rhinebeck, and then we'll also be down to Bowdoin. But just a great opportunity to be outside. We're still working on getting that skating rink frozen. It's freezing. It's just not frozen. I know that it's been cold. It's just not been cold enough long enough. But the skating rink will be open at Bowdoin Park as soon as it's fully frozen. Sledding is open at Bowdoin Park in the town of Poughkeepsie. And this is the last weekend of our story walk and holiday music at Bowdoin Park. And I hope you take advantage of that opportunity while you're out at Bowdoin. And thanks to our partnership with the Poughkeepsie Library District, you can see these life-size story walks, if you will, of the Snowy Day, the book Snowy Day. Great little book. And please visit us at Bowdoin Park. I want to thank our Dutchess County Parks crew and the Department of Public Works for all the work they did. For those of you, thousands of you who visited Wilcox, the good news is that seems like most people enjoyed. The bad news is we're going to have to try to do it again next year. And Sandy Washburn and the team are working on that. And also very grateful to all of them. All this is free. So the story walk and the music at Bowdoin, 3 to 5 p.m. this last weekend. And the ice rink will be open when it's frozen, and the sledding hill will be is open as long as there's snow on the ground. And that is all very free. So, more? Okay, let's go. I'm going to get to John's question in a minute. Victor, what percentage of the hospital beds and ICU capacity is there? Great. So if you visit the New York Forward website, you can find the regional numbers. We'll tell you that in Dutchess we monitor we have about access to about 450 beds. That is not a finite number because there are expansion capacity, etc. But we monitor about 450 beds in Dutchess. I will say, I think yesterday on our call there was access, and it's reaffirmed here, there's access to about 33, this is the share of beds still available, so 33% still available is found on the website. So if you go to the New York Forward website, hospital beds, 33% still accessible, right? And share of ICU beds available is 42%, and that's a 7-day rolling average. So if you go to New York Forward website, you'll see the regional numbers. Dutchess County does match that number, that capacity number we matched yesterday on our regional call. But hospital bed capacity availability is 33%. Share of ICU beds still available, 42%, and that is the regional 7-day regional average. John is asking, what is Santa getting me for Christmas? Honestly, time with my children. I was on the phone earlier today. I'm not looking for any sympathy. Somebody said, "You can take some time off." I said, "I don't know what that is," but I'm looking forward to seeing my children open their gifts, smile, and be happy, and spend some time with my family. I will tell you, my father and I would text each other first thing Christmas morning. That is not going to happen this year. And that does provide a bit of sadness, obviously, for us in my family. But I'm going to reach out to my sisters, reach out to my stepmother. But on Christmas morning, I'll be spending Christmas with my children and my parents who have been living in our home. And honestly, I don't need to unwrap anything this year. That is going to be good enough for me. 11 months of working with all of you, just having some time with my kids and watching them be happy is going to be the best gift I can get. So I hope you get those opportunities too, and I hope you find time for them. This has been a challenging year for everyone. Thanks, John, for the nice question. Bernie, you're welcome. Bernie loves that we always have translators. And we're very grateful to our American Sign Language interpreters. And of course, as you know, Dutchess County thinks differently. We used to think differently almost every day, and sometimes it gets a little bit in the background. But our goal here in this county government has been to encourage everyone to create opportunities and to tear down obstacles for those living with intellectual and developmental disabilities. And one important way of doing that is during time of crisis and emergency is making sure that everyone, regardless of ability or perceived ability, has access to information. So when it mattered, they've been here with us from day one. We weren't asked to. No one had to remind us to. It's what we do, and we're very grateful. So thank you to all of them as well. I will say that they will tell you, Bernie, that I talk very fast, and sometimes it's hard to keep up with me. And I've spoken actually to Diane's family. They appreciate me because this is her exercise. She doesn't have to run. She doesn't have to go to the gym. She just comes here and translates for me. We appreciate that. We're grateful that you mentioned it, Bernie, and I'm thankful to them as well. If you have an additional question, I'd like to get to as many as we can. We're going to wrap up in just a minute. Just write it down in the comment section below. I think we've covered much of what we wanted to cover today. I do want to remind you there are things that you can do to be safe. Let's stick with those basic protocols. Always protect yourself. And, as I said before, I was on a call this morning. The fellow said, if I have a cough, I don't assume it's the cold. I assume it's COVID. And that's probably the way to function. Just assume that if you're not feeling well, that's what you have. And then go through the steps necessary to protect your own health, to get the test necessary, and to protect the health of others. These things work when we all do them, and they certainly work when we're doing them together, and that is the physical distancing. Important. It makes sense, right? You don't want to cough on somebody regardless of what you have. So engage in that. Keep any of those gatherings small. That's the guidance from the state of New York. Is the guidance from us. Only people with whom that you trust have engaged in those same basic precautions. Always monitor your own health. If you're not feeling well, it's not the time to go to work. It's not the time to go off to a family event. It just isn't. Take those basic personal hygiene steps of washing, keeping clean, and what have you. I still remember my wife saying early on in this pandemic, has it come to this? We need to remind people to wash their hands. Yes, wash your hands, and wear a mask. And doing those things will keep us from spreading the virus. And as I said, if you feel like you've contracted the virus, please do attempt to be tested. We know that it's a challenge. I feel for you. It is frustrating. I know that. But do get tested and monitor your own health. If you have tested positive, here are a few things that you want to remember to do. So if you know that you've contracted the virus, it's important to begin isolating for two reasons. One, your own physical health, and two, the health of other people. So if you know you tested positive or you feel like you have, begin to isolate. If you're isolating at home, you want to be careful about this, right? Yeah, I live with my family. If I'm isolating at home, it would be in my best interest and their best interest if I isolate separate and apart from them. Three reasons: my health, their health, and third, if they are in close contact with me, their quarantine requirement is 14 days if they do not have any symptoms. It's 14 days from their last contact with me, symptomatic. So if I'm not feeling well, I test positive, and I stay at home and isolate in my house for 10 days, which is, by the way, if you test positive, it's 10 days from the positive test, forward, in particular if you're symptomatic, 10 days forward. If I'm at home and in contact with anyone else, all those individuals have to isolate for 14 days from their last contact. So if you can afford to do it and you're able to do it, you should isolate separate and apart from someone else. And hopefully protect their health, protect your health, and keep them from prolonging that quarantine requirement. So begin to isolate right away, and you should notify the people you've come into close contact with and tell them you tested positive, and they should begin to isolate and then get a test. And so again, you can return to normal activities after 10 days of isolation if you've tested positive. That is not the same as the CDC recommendation for 10-day quarantine. So let's do it again. If you test positive, begin to isolate right away. Contact those people that you've come into close contact with and inform them. And then you will be required to isolate and quarantine for 10 days after that test, and no fever for 72 hours, and your symptoms have improved. So in other words, you're feeling well, 72 hours, no fever, 10 days out from your positive test. Anyone who comes into close contact with you is required to begin isolating, to stay home, and obviously be aware of your health if you need it. Contact your physician or emergency. In emergency, dial 911. Monitor your symptoms, get tested right away, and you must stay home for 14 days from the last contact with a positive individual, even if you test negative. So again, if I test positive, I'm home, I isolate, and I isolate for 10 solid days, and if I have no fever for 72 hours and my symptoms are gone, I go back to my business. Anyone I've come into contact with must also isolate for 14 days, irrespective of whether they test positive or not. And those are things that you need to do. I think we covered that, right? If you have other questions, please ask them. We try to get to as many things as we can. We are beginning the holiday seasons, the last of the holiday season, Sean. We just completed Hanukkah. Happy Hanukkah to my Jewish neighbors and friends. Merry Christmas to those like me who will be celebrating. And so tomorrow begins the unofficial / official Christmas holiday, beginning with Festivus. Diane doesn't know Festivus. If you watch Seinfeld, you know Festivus. For the rest of us, I noticed and noted a few people. Let's try not to call people names. If you're communicating on our Facebook page, just be nice. That's equally contagious. Try, summon it, and be kind. And I will tell you this: we think very poorly of anyone who uses a word that ends with TARDS. I hate that. Absolutely hate that. The R word, out of our language. And if you identify someone as a blank TARDS, honestly, just not the kind of thing to say to other people. Please don't. But I understand everyone's a little bit frustrated. I know that we're a little more anxious than usual. I'll get it. Diane's phone's ringing. See, we're just so grateful for them. They're calling. But please, just be kind to one another. But with Festivus on its way, tomorrow, if you remember the Seinfeld, and if you read anything, it's a rough day.
Rough day. I lost my hearing aid.
Happy 50th.
Happy 50th anniversary. If you follow Festivus, you know that tomorrow is the day we set up an unadorned pole. You can see in that slide an unadorned pole. And we take grievances. You note my public works group from the buildings division. If you see the grievance booth there, they're all lined up 6 feet apart. They're ready to grieve to us. I can only imagine. But maybe you can air your grievances in the most polite of way, but don't do it in a way that demeans other people, please. Kindness is contagious too. But we're celebrating the holidays. I'm very grateful to the Dutchess County employees who collected toys, and we've distributed those across the countryside. We also last week, we were asked to help the Marines. You know, when the Marines need help, they call us. Ulster, Orange, and Dutchess County government was asked to help the Marines collect their toys for tots. So staff from Dutchess County government went around Dutchess County, collected the toys for tots. Grateful for those businesses who collected and for individuals who donated. Collected those, sent them out to the Marine Corps, and kids are getting thousands upon thousands of toys. Our public works team, often the holiday tradition is they go around county government and Christmas carol, and it's something that our staff looks forward to. They also go to Abilities First in the school out in the town of LaGrange, I think. Maybe it's Poughkeepsie, right on the line. And sing to those kids. And of course, we can't do that this year. So we did the second best thing you can do, and that is we had virtual caroling this week. And if you'd like to see some really good singing and my singing, you can see that. Is it on YouTube? Probably. You'll be able to share it and see it. But we also distributed that to county employees and to our partners in the Think Differently community. And I also want to thank the countless community organizations and individuals across Dutchess County who, as the Rotary Club motto, put service above self. So Tony, I want to thank the Kiwanis of Southern Dutchess for delivering toys to Mid-Hudson Regional Hospital and children there. But in general, I do want to thank Dutchess County, the organizations of every faith, every creed, every income level, every background, churches, houses of worship, community groups, all flipped the switch and really dug deep these last 10 months, 11 months to be of such great care and concern to their neighbors. And we are very grateful to you and for that. You note our grievance booth. Sean doesn't think it's as funny as I do, but no one ever thinks anything is as funny as I do. But our grievance booth, since the federal government didn't find it within their will to provide financial aid to state and local governments, we're starting a 5-cent a grievance booth, and hopefully after a few grievances we'll have raised a few $1 million to offset what we hope the Congress will find within their capacity to do early in the new year. So anyway, it isn't as funny as I think it is. Having said it out loud, it's not as funny as I think it is. Any other questions? We'll try to get to one or two last ones, and then we'll let you get on your way. Do want to acknowledge, thank you, Christy Ann. Is it true that hospitals in Dutchess support overflow from neighboring counties? How does that impact? It's almost the other way around. So the short answer is a little bit of yes and a little bit of no. All of the hospitals in this region support one another. Here's an example. We had that COVID cluster and outbreak at a facility in Beacon. That was what was that called? What is it? Hedgewood, excuse me, thank you. The Hedgewood Assisted Living Facility in Beacon. Most of the positive cases there were treated at a hospital in Newburgh because that was the hospital of proximity. So the short answer is that the hospital system in this region supports itself, and actually that's a good thing. Why is that a good thing? Because the Mid-Hudson region, next to New York City, has the most hospital beds per capita. So we actually have the ability to expand. It's one of the reasons that our percentages of occupancy are a little bit lower, and we have access because all of these hospital systems are able to lean on one another. So that's a positive for us. And we'll tell you, as of today, our hospitals are not filled with residents from other counties. They are mostly, I think in almost every case, our residents. But if we need extra access, right, our residents might end up in hospitals in neighboring communities, and we would do the same. That's the way the system works. That's not a problem at all because we measure the regional capacity. And in the case of New Vance, for instance, they have hospitals in New York and Connecticut they can rely on. In the case of Mid-Hudson Regional, they have Westchester Medical as a network, which includes hospital beds in Westchester and beyond, and hospital beds in Ulster County. So that allows us that flex capacity, and from our perspective, that is very helpful and very useful. So, as a reminder, we will not be coming live to you next week. I hope you understand. We're all working, but we're going to give you a break. We're also going to sort of reformat and be prepared for the new year. Again, we'll be doing a little more outreach on vaccine and vaccine information as we come into the new year. That'll start later in January into February. We'll also come to you live if there's a need to. If something changes or some important bit of information, we'll do that. I will say it's truly been among the most challenging years, certainly in many lifetimes. I'm very grateful to the employees of Dutchess County government who have risen to this challenge. They will continue to do so come the new year with less money and less people. We'll still dig very deep to provide the service and support that you expect from us. We ask you to be patient. Be patient on Facebook. Be patient on Twitter. Be patient in your own home. Be patient with your family. It's just been an overwhelmingly challenging time, and we respect the fact that we all are a little bit stressed. Certainly, Some of us have suffered a great loss, businesses that won't open again. Business people have poured their hearts, souls, and their income into the businesses, may never see that again. Families have been broken apart with loved ones living in isolation, still do. And of course, those of us who have suffered the loss of a loved one due to this or any other illness or challenge or tragedy in our community. We just want to be sensitive to all of that. Places. There's a question regarding testing. So testing is not free in every situation. There are some locations where you can access free testing. New York State requires insurance providers to cover testing for mandatory testing, not for just sort of casual testing. And I mean casual meaning if you're on the hockey team and the coach expects you all to be tested every week, that is not the same as someone who may have contracted the virus getting tested. New York State requires the insurance companies to provide coverage for the basic cost, but you may still have to pay for the copay. There are 2 locations regionally that the state has made available. Apparently you can get it anywhere you want in New York City, although I will tell you from my neighbors and friends in New York City, they are frustrated about lots of things. But the 2 locations that are free and drive-through, one is in Albany and one is in Bear Mountain, I think. Those are the 2 locations that you want to drive through. Doesn't mean you're going to get through quickly, but you can drive through those, and those are entirely free. Yes, it is allowed. So let me end today by thanking all of you, all of the residents of this county. I had a fellow who is regularly antagonizing of me on social media, in fact, to the point of being outright rude. He messaged me yesterday and had it wasn't a compliment. It was just an honest reflection that I was not at all mean or angry, and I thanked him. Even in those moments where you have said things that don't always make each other or us feel the greatest, you still have every right to say them, and you still have every right to have your government respond to you. And I hope that as we close up today, this town hall and this year, I hope that you have found this government at least responsive. We don't always have the answer you want. We don't always have the support that you need. But as we've often said, even if it is as last resort, our goal is to please you. And I know there's somebody saying, well, you can't please everybody all the time. I know that. My grandfather used to tell me, you can't please everyone all the time, and you have to admit to yourself and to them that is true, but it doesn't mean you shouldn't try. And so to the best we can, we try to be as responsive as we can. We try to be as helpful as we can, and I hope that you found that. But most of all, what I have found these last 11 months is that the human spirit can rise to any challenge, can overcome any tragedy, and that hope, in fact, is never failing, that light shines in the darkness, and that if we work together to strive toward peace and goodwill for all, we will at least enjoy the effort. And so with that, ladies and gentlemen, thank you for all that you've done in your community. Thank you for standing up to the challenges that face us. Thank you for being kind in the moments you have and understanding those moments you may not have. But most of all, on behalf of the people of Dutchess County, to those of you watching, and on behalf of my family, I extend to you our deepest appreciation, our unyielding love, and our prayers and hope for a Merry Christmas, Happy New Year, and a healthier New Year. God bless you. Thank you, and we'll see you in the New Year.